thanks for joining us again on Don't Go Uncovered. We're here really today to dispel some myths, and they are premium myths. A lot of false marketing out there. I'm here with Mark Carbolano again.
Rob, how are you? Good
Happy
day,
to have
sir.
you back.
Yes.
And that's really what we want to do, is dispel myths. And we thought the best way to do it was to actually walk through what happens when I call, what happens when I start the process of enrollment, so we can kind of walk through what an average income looks like, kind of what our customers sort of look like and experience.
I think first we have to dispel the myth. I'm seeing all kinds of marketing out there that the marketplace is closed, plans are completely unaffordable. I mean, we really have to understand that that is just not true.
Right.
There are a lot of people who it is expensive, but we really have to understand the value of insurance and really what comes about it. Mm-hmm. And we really want everybody to call. But let's do some demonstrations today, show everybody what it's all about, because I think they'll be surprised.
Yeah, let's jump in, because I thought the best way to start, let's start in Tampa, 33602.
Yeah, so I need a zip code. So, the good thing about this process, this is the same process that the agents are going to go through with our customers and people who call in. So don't be intimidated. The process is pretty simple, but at the same time, you really need a professional to be working with you. So you said
this
Tampa
is not
Bay.
A how-to.
No,
right.
It's a great guide just to see, but at the same time, because this is live, this is something that somebody can go do right now today. Mm-hmm. And if we stay on here, we'll probably get a phone call if we put a phone number in here. So, all right, let's talk about Tampa Bay, you said?
Let's do Tampa, 336.
Sorry about the Bucks.
33602. So everybody is.
What was that again?
33602. Right down the street.
Okay. So what we do is we're just going to skip all of this, and we're going to go right into C plans and pricing. All right. So let's talk about your family, right? So that's the first step in the whole process, is we need to figure out a family. So let's see.
I thought the best place to start would be the median income in Florida, family of four, gross annual is $70,000.
Well, let's start with who the family is. So 45-year-old, you want to say?
45-year-old.
Okay. Traditional family. So we got a husband and wife. And we'll make her 45 as well. Just keep things nice and simple. And then let's see what we got here.
School-age kids.
Oh, hold on for me 1 second. School-age kids.
Yeah,
how
10,
old are your kids
12-year-olds. Now? They're adults. They keep telling me they're adults.
That's what they do, but they're still not completely adults. What? Do they ever?
No. I'm not hoping.
So you want to say 16?
Yeah, sure.
16-year-old and about a 17-year-old.
Yeah.
Okay, perfect. And so we'll just get this information in here super quick. And I'm going to assume no one's pregnant, no one's smoking. We just, we obviously have some other things in here, not eligible for coverage through your work.
Right.
But let's just look at the rates. Now, we do have to talk about income. Mm-hmm. So you mentioned an income. So you said 72. What number?
72,000 is fine. It's right around 70.
Okay, let's do 72,000. So what this is doing is now it's outputting to us, as you can see on the screen, the amount of help that you are going to get from the government, $1,911 per month. And this is something that we can now apply to any number of insurance policies that you want to select from. And these are all the qualified health plans that cover all of your pre-existing conditions, have doctor visit coverage, prescription coverage, and all the things that we always talk about. And this is the reason to call.
So it can happen that quick, basically. Income, size of family, zip code, we can figure out what your tax credit's going to be.
That's it. We know that right now if you qualify.
Right.
Now, what the agent's going to do, as you see on these next couple of screens, we can search doctors, we can search medications, and then we can save our progress. But let's just skip for now. And just to show you, you can see here, from many carriers, you may not know the names of some of these carriers, but these are free plans.
Right.
These are free plans that someone is eligible for. There's also a lot of misconception about companies like Florida Blue. Is a good company, right? Oh, I can't afford it. It's expensive. They too have a free plan, as you can see on the screen. So you're not sad at having to give up on quality of coverage. You have name brand recognition with different carriers that are out there, but there's free available coverage.
And we've talked about the 10 essential health benefits before. These are all fully comprehensive medical plans that, people can be confident when they buy.
Absolutely. You're going to make sure that you work with an agent. You saw there was an option to search for your doctors, to search for your prescriptions. They're going to do that for you. So that way you don't pick the wrong plan.
Right.
Because that's what we see happen, over and over again. People try and do it on their own. They try and go it alone. And the next thing there they are in a bad plan, unhappy, miserable with the system, and they just
feeling like they've got nowhere to turn.
Correct, absolutely. So that's one, one option when we talk about that income. But we can raise that income. as well. I mean, you're right. I mean, we're talking family of four.
That. Right. So before we jump around the state and look at some other areas of the state, let's talk about that income number, because it's 70,000. I just picked that because it's the median income across the state of Florida.
Right.
But I've seen with you that income can go as high as $122,000 a year gross annual household income.
Yeah, and that is something. It's based upon how big your family is, so how many people are on your taxes. But let's use this same family of four and let's change that income. So what do you want to say, like 120,000?
Yeah.
I mean, that's good money these days. I mean, you're still getting $1,300 a month, and we're still able to cover everybody in the family.
I think that's another myth out there, too. I think a lot of people think that, yes, that is a high income. I'm not going to get any help. I'm not going to qualify. So they don't even really attempt to do it because it sounds like it's a high number because it's good annual income. And they think that they don't, but they actually do. Let's take a look. I mean, what are we seeing right now for that family making $120,000 a year?
So that family making $120,000 a year, they can still get, like we look at that Florida Blue plan. Let's take a look a little bit more. It's $400 a month. I mean, there's other options that are out there, but that's, $400 a month covering all four of your family members. So I don't know about you, but every one of my kids has got a cell phone. Mm-hmm. Every one of them is $50 a month right there. You know what I mean? Even in that family plan. So, you still have to be covered. You have to be insured, and you have to make sure that your family is protected, because the biggest thing by, a lot of people saying that it's too expensive, it's just relevance and how important it is.
Right.
I mean, we just heard this morning, a good friend of ours, right?
What
happened? Just normal weekend, moving, and then what happens? Ends up in the emergency room.
Not doing anything dangerous or
absolutely not.
I mean,
absolutely not.
But that's what happens. You can end up in the hospital in any kind of accident.
You never know.
Right. You never know.
You can't, and you have to do not go uncovered. Anyone that is listening to us, that is the one thing, because when it hits closer to home, it's too late.
Right.
It's too late.
So when you talk about that, obviously not going uncovered, but I do want to make the point again that the zero premium plans are still out there, and we'll jump around to the other parts of the state, and also low cost and affordable plans like the one you just mentioned, a couple $100 a month, you're covering a family of four. A lot of people there's misconceptions out there that those plans they're not going to qualify for that plan. There's no way I'm going to get that plan.
Correct. And the process is confusing. Right,
yeah.
Because what income is going to count? I'm asking, you're giving me an income number, but there's somebody listening or somebody's thinking about how do I know what income do I put in there?
Right.
And that's why you have to talk to an agent, because that agent is going to be able to look at that income, look at where it's coming from, and make the proper assessment. You may be eligible for group insurance. You're like, oh well, I have to get it through my job.
Right.
That's not true, because if that's unaffordable, we can help you as well.
Okay.
And that's unaffordable in the government. It goes through these rules, but these rules are understood by the agent.
Right. But Obamacare, the Affordable Care Act, has not been overhauled. It's not disappeared. It's not gone away. It's really where it was in 2019, correct?
Correct. Absolutely. And we are hopeful that there is some sort of approval in the near future. In maybe December, January, we get some extension of subsidies, and then a lot of the people who lost their subsidy get that back. And that'd be great news for people, across the nation.
Okay. Well, let's do some quick hits. I'm going to give you a couple more zip codes.
All right.
I want to go through them as fast. I want to prove the point. I want you to help me prove the point that the zero plans are still out there, and very low-cost, affordable plans are out there all over the state.
Okay.
Another very popular area for us always is South Florida.
South Florida.
Miami. Okay. 33161.
All right. 33161. Same household of four. We want to do that same middle Florida income of $72,000, I believe you said.
Yeah.
$2,000 a month in subsidy. Every single month, that family has access to $2,000 worth of subsidy, and then from there, they're going to get qualified for a free program down there.
That is unbelievable. I mean, really, because it does make a difference where you are in the state, correct?
Correct, absolutely.
Right. So let's pick another area. There's a couple more that are always very popular with our members. We have a big contingent of policyholders in Orlando as well.
Mickey Mouse.
Mickey Mouse.
I mean, there's not just tourists in Orlando. That's it.
America's
people with
favorite
the Mickey
vacation
ears.
spot.
And are you an adult Mickey adventurer?
Absolutely not.
No,
I went on the
don't
Disney
see
cruise
that.
once. That was.
There's no casino on that, is there?
There's
not?
no casino on that. There's 3,000 teenagers and little kids.
I guess if you have a teenager,
it's a lot.
If you have a teenage boy or teenage girl, that
It's a
would
lot.
probably be nice.
Yeah.
but
The
no
bars
casino.
are always very busy.
I bet they are. I have to say, I do not know off the top of my head a zip code.
I've got one for you.
Okay, give me it.
32806.
Driving through Orlando these days is just an absolute nightmare.
It's never going to be fixed.
Ridiculous.
Yeah.
Absolutely ridiculous. All right, so here we are in the land of Mickey. $2,000 worth of savings on your health plan, offered by the government, and also, if I scroll down, free coverage from a multitude of carriers. Right, so these people are going to have lots of access to care. They're going to have, insurance policies that are going to work for them. And again, our agents will check the networks for them, make sure that they understand what they have, what they have available for them. Oops, I got the wrong button clicked here. And really make sure that they get the access to their doctors and hospitals and be able to go to the places that they want to go to. The problem with the healthcare is if you don't have it, is getting that follow-up care.
Right.
Let's just talk about our friend again. She's in the hospital. God
May
forbid
need
they
rehab.
found something. You need rehab. You
Right.
need to recover. If you're not insured, you're gonna go to the hospital, go to the emergency room. They're gonna staple you up, do whatever. Say thank you, Rob. Have a nice day, and go to your
And that's
local.
not the care we're looking for.
No, people deserve better than
Right.
that. And so these policies will all give them that option.
Okay, great. Let's.
What other zip code do you want to look at?
Broward County,
Orlando.
always.
Broward?
Yep. This is Dania Beach.
Oh, that's
So
fun.
I'm from down there. I'm not very familiar with Dania Beach.
Really?
Yeah, I think there was Highlight there.
Yes.
Wasn't
but
that Dania Beach
But
Highlight?
Dania Beach is by the airport.
Right.
Yeah.
It's south.
Yeah.
Just south. But that's what they were famous
That's
for.
where that roller coaster used to be on the left-hand side if you're driving down
By the
95.
go-kart
And I
track?
think now they have Bass Pro Shops is there. I
Oh.
think there's the big giant Bass
Always.
Pro Shops.
Corporate America taking over.
Yeah, so what's Dania Beach?
33004.
Okay. So again, same pretty much $2,000 worth of subsidies, multitude of carriers I'm seeing here on my screen with available free or no cost coverage. So again, it's a myth, right? And again, you want to move that number up to a much higher number like 120 or 115. You're still getting a substantial amount of savings every month. $1,400 in savings and access to very low cost coverage.
And what a little bit about the options too, because you're talking about jumping from maybe a zero plan, maybe that doesn't quite fit, maybe you need more benefit. You're jumping to a couple $100 a month, or maybe $500-$600 a month.
Right.
What's the difference? What's the customer look like? Why are they choosing, or why are we helping them choose those from those different plans?
So you're really asking me what's the difference between a low cost option plan and something that I'm now paying for? Okay. So the agent's going to take you through that, but what we do is we look at the nice features.
Right.
Okay, so think about it like going to buy a car, right? So you can get a car that's going to get you around, get you where you need to go, but it's not necessarily going to have power windows, power door locks, right? No pretty screens. We were just talking about
That's
pretty
right.
screens and
Touch screen.
fingerprints all over the screens and how that's just nasty.
Those can be dangerous too.
Just gross. Yes, evidence. So with all of that, that's the difference in the insurance policies. And what you need is different than what I need, right? So you like to go to the doctor, you do your annual examinations.
Wellness.
You get. So let's just be clear. All of your wellness is covered in all the plans.
Right.
So your annual examination, your blood work for your annual examination, all of that is going to be covered at
Even
no
if I'm
charge.
paying zero.
Even if you're paying zero. Even
Okay.
on the lowest low-cost plans, that preventative care is going to be there for you.
Right.
All right. And that's now when the next step. Now, you want teledoc? No problem. Built into all those policies as
Okay.
well. So pick up the phone, talk to them. Now, when you start to get into, I want a specialist copay. I want a doctor visit copay every time I go. Now, that's where the price starts
Yeah.
to rise. You're going to get your prescription drug coverage. You don't take a lot of prescription drugs. Well, you don't need a copay on them, right? You get a generic, it's a low cost. So that's going to be, no power windows and door locks. And then I want
Right.
the copay. I want to pay, $35 for my Ozempic or whatever the medication is that I'm taking
Right.
now.
But easily addressed, right?
Yeah,
When you
just-
call us.
But that's what you're paying more for.
Right. Okay. More of the specialty care, specialty
Correct.
need. Maybe I've got something chronic going
An
on.
MRI copay,
Right.
You know that you want that luxury.
I gotcha.
I want that in my car, and that's some people want that.
Okay, so we have definitely done, I think, an admirable job, a good job showing people that the zero premium plans are out there everywhere, all over the state. Low cost plans out there, plans for everybody.
We did do it where the people are. So, you have to call because
Right.
if you're living, we just did some major metro areas, but if you're living in Lake County or, somewhere else a little more rural, call us today, please.
Okay. And then, what happens after they become a member with us, a family member, don't go uncovered. I see a lot of people asking questions about, what if I get a claim denied or I can't go see the doctor? I want to go. What's the solution at that point?
That's where 100% having us in your corner, having one of our agents and being a part, as you said, of the Don't Go Uncovered family makes a difference. So our agents are going to be there for you. They can call that agent. The agent can help them through a claims process. So legally, you've got a grievance program that you can go through and you can file an appeal and you can contact the insurance company and do all of those things. But you have nobody in your corner. You're
Right.
great.
You're flying blind.
Yeah, just call the number on your back of your
No.
card. That's not the way it works. So
We've all had experiences like that.
It's the worst thing ever, right? But at least you have someone that can give you that direction, right? Point you in the area that you need to be going to, so that way you're not just going it alone.
Right.
Really, that is the big thing. But the process is pretty simple. You get the phone number of the person that helps you. They're here in Florida. They are, Florida people, so they know the area, and that's why we want them to call.
Right. And folks, we've been doing this for 40 years, and you don't want to risk having no coverage in 2026. And that's what's going to happen because time's going to run out. It runs out every year on enrollment. The window is short. If your deadline right now, if you're viewing this probably in the next couple of weeks, is December 31 for a January 1 policy. Doesn't give you much time, but we're here. We're ready to help you immediately. And now you've seen the plans that are going to cost you a little or zero. So we're encouraging you to call the number on your screen. Also, if you'd like to comment uncovered on any of our social media platforms, we'll be able to let you, you'll be able to follow us. We'll be able to help you out. We'll be able to get in contact with you. And call today. Do not let time run out.
No, please do not.